So to get started off on today's topic, I want to talk about an external case that was presented to Colorado State University at the end of last year. It was a blood film from a 12-year-old female spayed French bulldog that had numerous atypical neoplastic cells. And when alkaline phosphatase, or ALP, was applied to these cells, it did show up as positive. And based on the characteristics of these cells, which I'll go over a little bit more on the next slide, the main differentials were a mast cell tumor with hematogenous involvement or another hematopoietic neoplasia. So to delve a little bit more into the characteristics of these cells, they have round, lobulated nuclei, pale to moderately basophilic cytoplasm with pink to purple granules, and some even having a mast cell-like appearance. And this mast cell-like appearance is especially seen with the cell in the upper right-hand corner. Unfortunately, I don't think the point is working, but on the image on the left there in the upper right-hand corner, there's one of those mast cell appearing cells. Unfortunately, we don't have much more information on this patient. We do know that she had a splenic mass on abdominal ultrasound, but no sampling or further diagnostics were done. And with the follow-up phone call, we learned that the patient was continuing to decline. So while we don't know the specific outcome of this case, the ALP positivity with the possible differential of a mast cell tumor does beg the question of the role of ALP reactivity in mast cell tumors. Hence, the project was born. So to cover ALP a little bit more, ALP is a membrane-bound enzyme that is in numerous mammalian tissues. There are 4 isoenzymes: placental, germ cell, intestinal, and liver, kidney, bone, also known as tissue nonspecific. ALP reactivity is most commonly used in veterinary medicine to identify osteosarcoma cells on cytology. However, again, there's very little known about ALP reactivity in mast cell tumors. And when discussing staining and labeling of mast cell tumors, what also comes to mind is mast cell tryptase. Mast cell tryptase is a protease enzyme that is found in mast cell granules that's readily stained with immunohistochemistry and shows up a nice bright pink. However, there's limited data on the use of immunocytochemistry for mast cell tryptase labeling, with immunocytochemistry, or ICC, being another immune labeling method to identify cells that can be used on cells in culture, suspension, or cytologic smear prep. And finally, when discussing mast cell tumors in a cytologic sense, the topic of cytological grading of mast cell tumors is certainly an area to learn more. There was a study published in 2016 providing a 2-tier grading scheme for mast cell tumors using the criteria of mesokaryosis, nuclear pleomorphism, multinucleation, and mitotic figures. And a overarching project to this one is underway at Colorado State to learn more and delve further into cytological grading of mast cell tumors. But today, given what we don't know about ALP reactivity and immunocytochemistry labeling for mast cell tumors, as well as their relation to the cytological grade of mast cell tumors, we proposed the objective to evaluate the association of ALP reactivity and tryptase ICC labeling with cytological grade of canine mast cell tumors. So to get started on this objective, we searched the Colorado State slide archives for canine patients that were diagnosed via cytology with mast cell, skin-associated mast cell tumors, and between December 2021 and November 2023. And we were looking for at least 3 to 4 slides of good diagnostic quality, and using this criteria, we were able to include 38 canine patients in this project. Now, in order to evaluate the ALP and tryptase labeling and the differences among those with cytologic grade, we need to assign a grade to these 38 cases. And this was done by 2 ACVIM boarded pathologists at Colorado State. The grade was assigned independently for all 38 cases, and then any discordant cases were reviewed by both pathologists, and a consensus was made, and Cohen's kappa coefficient was used to analyze the inter-rater reliability. To assess ALP reactivity, all 38 cases were destained with acid alcohol, and then the phosphatase substrate was left on there for an hour. During this hour, the substrate was dephosphorylated by any ALP enzyme present on the sample, and a oxidation reduction reaction produced the color change that you see on the far side of the screen here, and that would be a positive result. So again, the two board pathologists reviewed these, assigned a positive or a negative, and Fisher's exact was used to statistically analyze the difference in ALP reactivity between the high and low grade tumors. And then for the tryptase immunocytochemistry labeling, just of note, only 28 cases were included in the tryptase labeling due to the availability of good diagnostic quality slides. They were placed in a Lycobond 3 system, and a anti-mast cell tryptase AA1 antibody, which is a monoclonal mouse antibody, was used to label these cells. And when the labeled antibody would find the mast cell tryptase, you get this nice pink color change on the slide. And again, the two board pathologists assigned a positive or negative result, positive being that pink color that you see there. And then Fisher's exact was also used for statistical analysis. And on to results. So first I want to touch on how the cytological grading scheme that was applied to these 38 cases. So between the two pathologists, there was agreement among 36 of 38 of the 38 cases. This provided a Cohen's-Kappa coefficient of 0.86, which according to interpretive values, this is a near perfect agreement. And I do have a table up here demonstrating the breakdown of high and low grade cases among those total 38 cases, as well as those with nodal metastasis. Now, we didn't include nodal metastasis or other aggressive behaviors in our statistical analysis, but it would just raise our eyebrows at the fact that 9 of the cytologically low grade cases did have nodal metastasis, and this is something to be explored further in that, again, that overarching project that I mentioned ongoing at Colorado State. And on to the exciting. So the ALP results, again, alkaline phosphatase reactivity. So the majority of the canine mast cell tumors demonstrated negative result as far as ALP reactivity, which is demonstrated by the pink in this graph here. However, there were 2 cytologically low-grade cases that did demonstrate ALP positivity, which is quite interesting. Given this data, the p-value from the Fisher's exact was 1, meaning this data does not support a difference in ALP reactivity between cytologically high and low-grade tumors. However, it is still interesting that 2 of those cytologically low-grade tumors were ALP positive. And just of note, one of those low-grade tumors did have nodal metastasis, which I touched on in that last slide as well. And on to tryptase. So the majority of the mast cell tumors were tryptase positive, as indicated by the blue. There was 1 tryptase negative result, meaning we did not see that color in there, and that was of the cytologically high-grade tumors. A Fisher's exact produced a p-value of 0.29, indicating that there is not support for a difference in tryptase immunocytochemistry labeling in cytologically high versus low-grade tumors. So talking about what we have learned from this project, an association between cytologic grade and ALP reactivity or tryptase labeling was not found. However, I did demonstrate that immunocytochemistry can be used for mast cell tryptase labeling. When applying calculating the sensitivity using this data set with the assumption that the negative result in that high-grade tumor category was a false negative, the sensitivity comes out to 96.4%. And while skin-associated mast cell tumors are most commonly, in this project, were most commonly ALP negative and tryptase positive, there again were those 2 ALP positive results, which is begs the question as to why those mast cell tumors did produce positive results. And it would certainly be interesting to explore that more. One of the limitations of this study being the smaller sample size, so it would be interesting to explore that more with a larger sample size as well. And just a friendly reminder, go to complete evaluations for the session. And a big acknowledgement and thank you to Dr. Russell Moore and Dr. Lisa Schlein for contributing to this project from start to end and serving as fantastic mentors, and it's been a pleasure working with them during this throughout this project. And with that, thank you very much. I'm happy to take any questions now, or feel free to contact me after as well. Thank you. Any questions for Dr. Dunstan? Thank you.